So when a typical patient comes in, I start with inside approach first, and then gradually go into the aesthetic part so that, because if you look good, you feel good, and vice versa. And patients, when they're starting to taste better quality of life, they're now focusing on themselves finally, and then they become interested in aesthetics.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. This episode is brought to you by Edna Digital Marketing. Now I have Dr. Mahmood Siddique here of Sleep and Wellness Medical Associates. Dr. Siddique is a quadruple board-certified physician who takes a modern, holistic approach to patient care at his practice in New Jersey. He is also a clinical associate professor of medicine at Rutgers Robert Wood Johnson Medical School and a fellow of 3 prestigious medical organizations. Dr. Siddique is passionate about restorative and regenerative medicine, which involves lifestyle changes, hormone balance, anti-inflammatory nutrition, toxin removal, and stress management. In addition, he is a director of Innova Skin and Laser, where he specializes in the latest and most advanced aesthetic procedures, with a focus on non-invasive face and skin rejuvenation. He has also received numerous awards and recognition for his exceptional skills and dedication to patient care, including multiple New Jersey Top Doc Awards and the Patient's Choice Award. So Dr. Siddique, welcome. I'm glad to have you here.
Thank you for having me.
Yeah, so let's just dive right into it. Tell me, Dr. Siddique, how did you actually get interested in aesthetics to begin with?
Well, just to give you a little bit of my background, I used to be intensivist at Robert Wood Johnson Medical School, and I used to eat, breathe, and sleep basically sickest of the sick patients in the hospital. And I did that almost a decade of my life after I finished my fellowship at Case Western. And I was loving it, I was enjoying it, I enjoyed that adrenaline and all that. But then I was really burning out. I realized that I was spending tens of thousands of dollars in first 2-3 days on the patient's life, and the patient is really not necessarily getting better. Many of them would die in the ICU, just as you know, just simply being in the ICU buy a ticket to mortality. Mm-hmm. And these patients have multi-organ system failure, they're on ventilator, they're on drips, they're on dialysis. So I kind of realized that this is not what I want to spend the rest of my life doing, although I love the physiology and I love the adrenaline. So I started reinventing myself and started taking courses into hormone balance, nutrition, regenerative medicine. And then I realized that there's so much more I can do for my patients in terms of prevention and improving their quality of life, improving their function. So I kind of left my previous group and set up shop of my own, and then gradually started to delve into each patient from head to toe about their mind, body, their nutrition, their stress, their hormone balance. And then I started realizing that it's so much more rewarding, and patients started appreciating me more because I would give them the time that they needed. And that allowed me to diagnose a lot of their autoimmune issues. And because of my sleep background and pulmonary and internal medicine, I had the breadth and depth of knowledge, but now I'm able to spend the time, and that became very fulfilling for me. And then patient would bring their whole family, their friends, their neighbors, and then my practice started to flourish. And then I started hiring other professionals. For example, I incorporated intravenous IV infusion therapy, blood labs, started looking at nutrients, added nutritionist, physical therapist, behavioral therapist. Now I have a very comprehensive practice where we do a very deep dive into patients' physiology, and we make them look and feel their best from inside out and outside in. And that's I continue to progress on. And now I've been doing this for over a decade now, and I have about 25 employees. I'm very proud of my team, and it's a little one-stop shop in my practice.
Yeah, that's great. Now, we were talking a little bit about this before the show, and what you were talking about a lot, what you do in your practice is a lot more of that holistic health. It's not just aesthetics. So could you talk a little bit more about how you made that transformation of doing what you were before and now focusing more on providing that holistic health to your patients?
Correct. Before I was doing more acute care, the patient would come in with illness, and then I'll try to figure out how to make them better. Now my job is to not only make them more wholesome and project them toward wellness, but actually improve all their functionality. So, for example, I'll give you an example. A patient not too long ago came to me. He was fatigued, tired. He wasn't focusing, concentrating. His stress level was 8 out of 10. And then I did very comprehensive blood work. He had a nutrient deficiency. He had low testosterone. And then turns out he had sleep apnea. I did a sleep study in my office. I did some other blood work, showed that he had very low iron level, vitamin levels. And that allowed me to now optimize him from his hormone standpoint, nutrient standpoint. I helped him lose weight. I helped him sleep better, breathe better. And now he's feeling that he lost almost 40 pounds in the last 6 months or so. He no longer has sleep apnea. He was pre-diabetic. So that pretty much improved his hemoglobin A1C is near normal. He was on the verge of progressing toward full-blown diabetes. He was already having sleep apnea. Now he is not on any medications. He's basically taking supplements, probiotics. He's on hormone balance, giving him testosterone, and he's living his best life. And he's very productive. He loves gardening. So that's just one simple story. And I have stories after stories all day long. And I love hearing these stories from patients that how well they're feeling. And that's what I mean by holistic health, because we're more proactive instead of being reactive. So my previous career was reactive medicine, trying to do acute care and fix their sleep, although that was necessary because they're experiencing a catastrophic illness. Mm-hmm. Now it's more rewarding for me to take care of patients from otherwise maybe very sedentary lifestyle to highly productive lifestyle.
Yeah, that's a fantastic story. I mean, I hear these stories about people making a complete turnaround in their lives, and it's doctors like you who provide that help to them. Now, that's one story that you have. What would you say are some of the most popular treatments that your patients come to you for? And also, why do you think those are the most popular ones?
So we're big on weight loss. Also, I do regenerative treatment. So regenerative treatment means that you are revitalizing them, whether that's through balancing their hormones or giving them exosomes or platelet-rich plasma. I do a lot of sports medicine as well. Patients present with tendinitis, joint dysfunction, and also we do a lot of aesthetics. For example, minimally invasive regenerative aesthetics, which is very popular now. Patients are looking to look their best, their natural best, and we can help them with whether it's radiofrequency microneedling or rejuvenating resurfacing laser followed by exosomes or PRF technology. Many of these I can elaborate further, but the point is that patients are looking for their natural best, and we believe in helping them inside out. So we tell our patients that we're not skin deep or mile deep. So look deep, take a deep dive into their physiology. And I tell them that my microscope is from 4,000 feet view to their mitochondria. Mm-hmm. So we look at their entire blood work. We look at their lung function, heart function, their maybe food allergy, food sensitivities. We're big on gut health. A lot of patients, we find that they have leaky gut syndrome, they're micronutrient deficient, and before you know it, they're always fatigued, tired, low energy. And then when you take full inventory, we find out that they're eating, for example, gluten. They're very sensitive to gluten or dairy. They're eating foods that are very pro-inflammatory. So we clean up their diet, improve, put them on, let's say, probiotic regimen, improve their gut health, brain health, immune health. And then we start working on their skin health from organic SkinCeuticals to all the way energy-based technology, RF microneedling I mentioned. We use Sculptra, which is biostimulatory fillers. I also do a lot of PDO threads, which is becoming increasingly very popular in my practice. And we do some online marketing for that. We can talk about that more. So I can go on and on how, so when a typical patient comes in, I start with inside approach first, and then gradually go into the aesthetic part so that, because if you look good, you feel good, and vice versa. And patients, when they're starting to taste better quality of life, they're now focusing on themselves finally, and then they become interested in aesthetics.
Okay, perfect. Now, you talked a lot about the holistic side of it, and I'm sure that a lot of patients that come into you, they may not understand a holistic approach to their health. They just think that, or they just know, oh, I can't sleep well, or I'm overweight, or I feel terrible, or I have whatever it is. They have no idea what that root cause is. So how do you approach educating your patients about this holistic approach when they came and they had no idea that the holistic approach even existed?
Exactly, because they're used to conventional medicine, which is when you get sick, you go to the doctor, and the doctor only has 15 minutes, if that, and quickly write a couple of prescriptions, you're done with their visit. My typical office visit is 45 minutes to 1 hour, especially new patients, follow-up patients, 30 minutes to 45 minutes. And then even if it is their 20th visit, they get the time from me. In a typical day, I'd probably see 12 to 15 patients a day. And if I'm doing some procedures, that may vary depending on the time. So I lay out the foundation of what functional medicine is all about. I define the term to them that my goal is to improve your function in every scope of the word, how you're sleeping, your sexual function, your mood, your stress management, your gut health. And then overall, you should look and feel younger than your physiologic age. So, and then that speaks to them and they realize, wow, this is really breath of fresh air. And I utilize their insurance. A lot of times, patients would think that, oh my God, they have to break the bank to see a holistic doctor who is spending 45 minutes with me. That's not the case with us. So we check their benefits, and if we take their insurance, we're able to go all out for them. And then layer after layer, I get to know them at a deeper level. And I'm proud to mention that we have 3 behavioral therapists in our office. Since the pandemic, as you can imagine, that patients are experiencing more mental health issues that hasn't been addressed before. So now we're addressing mental health, physical health, and aesthetic health. And that's what I call holistic.
That's fantastic. I mean, it's a complete, like you mentioned before, it's a one-stop shop. It's everything that whatever they come to you for, like you're able to help them out. So now I want to talk about what differentiates your practice from others in the industry. We talked about the holistic approach quite a bit, but I know you have a fantastic team that's also backing you and supporting you. Would you mind telling me a little bit more about your team?
Absolutely. I'm proud of my team, and I'm proud to also say that I don't have any office manager. I have team leaders, and these are a group of very devoted and dedicated people. Their singular goal is to take care of their patients with their loved ones. And I do spend a lot of time with my staff. We do biweekly meetings, we do team building efforts. And I believe in servant leadership. My approach is to serve my people, and nothing happens without my people. So I truly believe in, of course, patients come first, but before that, my people come first. So I invest time and money in my people, and then they are very dedicated. They take ownership of what they do, and they take pride in them, and I optimize their knowledge, whatever tools they need. I truly believe in being their mentor. I routinely tell them that I'd rather be your teacher or mentor than your boss. If you think there is a boss, patient is your boss. I just happen to sign the paycheck. So that being said, so my team does all this magic for me, although all I do is kind of a cheerleader. I am the kind of conductor of the symphony. And then they all have their own roles and responsibilities, and they do it with pride and dedication and devotion. And patients after patients, if you look at our reviews, the common theme is that they're kind, they're professional, they take the time, they listen to me, and they have been very responsive. And that's what we like to put ourselves to that standard. We believe that what separates us from other practices is that we spend the time and we take care of them like our family, the way we want to be taken care of. I'm not saying other practices don't do that, but I think another strength we have is we're, like you mentioned, one-stop shop. So it adds to the convenience, and we are not volume-driven practice, we're quality-driven. So we believe in quality over quantity, and also the most important precious thing we deliver to them is our time.
Mm-hmm. Yeah, I think that it's really a testament to your team's professionalism, the care that they give to the patients and all that, because as you were saying, like for your online reviews, what people are saying about you, but I think one thing that's important to note is that your practice online on Google, you have over 300 reviews, and it's like a 4.9 star rating. It's just incredible. But
and thanks to my amazing patients, I'm so grateful to my amazing patients. And I grew my practice word of mouth simply. And many of the patients, when I routinely ask them, how did you find us? Well, you came highly recommended by so-and-so, a coworker or a neighbor, or just online reviews. And I love that. That warms my heart.
Yeah, I mean, it's fantastic. I mean, it's rare to see not only just a practice, but a business having that many positive reviews. And again, like really kudos to you and your team for being able to create that culture, both for your team and also to provide that to your patients as well. Now, Dr. Siddique, I want to ask you about switching tracks a little bit. Do you see any new or emerging treatments out there in the market that you're particularly excited about?
Yes, so I'm excited about this regenerative aesthetics that involves multi-modality technologies and case, for example, radiofrequency microneedling combined with exosomes, followed by, let's say, Sculptra or hyperdilute radius or PDO threads. And all these things will produce collagen, elastin, are longer lasting, better ROI. And at the same time, it produces natural best cells. So it's no longer just one size fits all. It's no longer just the toxins, no longer just the fillers, no longer just the threads or lasers. When you combine, and I believe that more tools you have in your toolbox, and we're always investing in cutting edge technology so that we are able to deliver for our patients with results. I'll give you another example. We do a lot of sexual health in our practice, men's health, women's health. So we have this shockwave technology that has been revolutionizing my practice, that on a regular basis, we're treating men's, women's health, whether erectile dysfunction or orgasmic dysfunction or hormone imbalance. So when I combine shockwave, I use that to improve blood flow, break up plaques, and then follow it up with exosome or PRP injections to rejuvenate tissue. And sometimes we also would do microneedling or laser to improve, let's say, vaginal laxity. We do a CO2 laser that improves collagen and improves postmenopausal dryness. So these just expands the breadth and depth of our service offerings, and patients are so appreciative because once we ask them, hey, do you experience any kind of stress incontinence or urge incontinence, or do you experience painful intercourse, or for men also they have lack of desire, then we check blood work to see what their hormone levels are. So with this multiple approach, and a lot of these patients, because of embarrassment or taboo or shyness, they're not talking to their clinicians about these very vital and fundamental issues. So I make it a point to bring it up routinely. How is your sex life? How is your stress? How is your sleep? Some of the basic open-ended questions, you would be amazed the wealth of information you receive, because now patient realizes that you have the time because you're asking those questions, and they're more than willing to tell you all of that once you open the door.
Yeah, no, that's fantastic. And that actually kind of leads me to another question. It's when you get some of these patients that come in and they really maybe don't know what's bothering them, or they don't know what to ask, or they maybe feel uncomfortable. And I'm sure that some of the recommendations or treatments you provide to them, they probably didn't even know it existed before they walked into your door. So how do you balance providing that relaxing experience for your patients, but also balancing that with their safety and well-being during the treatment?
Right. So I'm all about educating them. So I don't sell anything. I educate, educate, educate. So, and then that creates opportunity for them to ask me more questions. And then I would show them the solution, whether that's a technology or a procedure or a device or a product. And then I would show them before and after pictures. And in terms of aesthetics, I routinely show them how the face ages over time. My approach is when they come in for consultation, I take their picture in a standard protocol I follow, and I put their picture on my screen, and then I show kind of some slides that I show 10 slides, how the face ages over time, the 3Ds, the deflation, deterioration, and descent. And they are really very riveted to that, and they're looking at their face and I'm showing the aging face. And that even though, for example, they came in, hey, can you put some filler over here? But then once I do a very comprehensive approach to the consultation, then that creates opportunities for other treatments compared to what they came for. So during my educational session, then I would pull up my consultation sheet, and then I would go through how their aesthetic journey should be if time and money were no object.
Okay.
and then they would then take a piece by piece. They would ask me, okay, what should I do now? And I would say, well, we can start with toxin first, perhaps, and then maybe later on we'll do some Sculptra to build collagen. Maybe followed by microneedling and exosomes, followed by maybe some lasers to an IPL to help with your pigments. So it's an aesthetic journey. And then once you walk them through the journey, it becomes more bite-sized piece instead of feeling overwhelmed. Oh my God, I can't afford $10,000. But if you give them that journey, it's more absorbable for the patient, and it's more doable.
Okay, I'm sure they have a much better experience too, like they're not completely confused about what they're getting into.
Right. Yeah, and as you mentioned, they have sometimes kind of very early knowledge about it, but when you take a deep dive and show them, and all the way to before after picture, they are in awe, like, oh my God, I didn't realize threads do that. I thought threads were very painful and barbaric and sometimes could be deforming. But they realize that it could be very rewarding. Results are pretty immediate and longer lasting, and it's cost effective. So they are now kind of experiencing a new technology that they never heard of.
Mm-hmm. Now, you mentioned before one of the great story about a patient. Now, what I hear in the space a lot is that there's patients that are out there trying to find a solution to their issues, and they're going to 10 different doctors. Each of those doctors can't solve the problem for them. I'm sure, especially you coming from the holistic side, you must have a ton of stories of situations like that. So is there another story that you can share about someone who's had just that experience where they tried everything, nothing worked, and it's basically down to like, you're my last hope, doctor? Like, have you had stories like that before?
Yes, that happens fairly routinely in my practice. Many of them have been to specialist after specialist and gone through test after test, and it's still frustrating. So I'll tell you this another case. She has been through neurologist, rheumatologist, endocrinologist, even cardiologist. It turns out that she does have autoimmune disorder, but it's not just autoimmune disorder, it's a combination of factors. She has fibromyalgia, chronic fatigue syndrome. She also suffers from poor sleep. She has high anxiety. She has irritable bowel syndrome. She has those trigger points due to fibromyalgia. And then she has a lot of other musculoskeletal pain, for example, plantar fasciitis. She then turns out she has cervical dystonia, which is stiffness of the neck with turning to the point she would have tremors on the face. So it's, and then all the other specialists, they just looked at through that tunnel of their lens. They didn't look at the whole person. It's just like, the multiple scientists looking at the elephant, but one person looking at the leg, another person looking at the tail, another person looking at the nose, another person looking at the trunk, but they don't know what it is. But once you have an elevated view and oh, that's an elephant. So, and then all I did was spend the time, and I did my standard approach, finding out about their gut health, their hormone health, and then I really took a very comprehensive approach to blood work and a few other diagnostics. But most important thing that led me to a very comprehensive approach was just history taking, just to get to know my patient, what her stress level is, what her lifestyle has been. And then I started working with her on cleaning up her gut health, cleaning up her nutrition. I started balancing her hormones, optimized her sleep, gave her some micronutrients, IV infusion like NAD+. NAD+ is big in our practice, which works on reducing the burden of inflammation. It also, we are big on glutathione, vitamin C. All of these also improves your skin. Your skin starts to glow. And the patients realize that they're revitalized, they're sleeping better. And as you know, when you have restorative sleep, you have less perception of pain, you have better cognition, you have better focus, and you're more productive during the day. And that also reduces your anxiety and stress perception because you are being more productive. You're not falling behind in your daily chores. So it just is continuously up and up. And then, it turns out that she had a very low testosterone level. I gave her progesterone capsules at night that improved her sleep and sense of anxiety. And testosterone improved her libido, improved her strength. She was able to work out at the gym. So all of these little things turned into synergy into her overall improved quality of life. Now, is there a cure for any of these things? No. But did I improve her functions? Absolutely, yes.
Okay, that's a fantastic story. I mean, it just from the sound of it, it's like, man, sounds like she has every condition out there that's possible. But I mean, it sounded like you're able to completely turn her life around when a lot of specialists couldn't. So, and I think that's fantastic, seeing like how holistic care is really starting to gain some more traction. I'm starting to see out in the market more and more of the aesthetic practices focusing on holistic, just because you bring so much more value to your patients. So do you think that's where the future of aesthetic care and even holistic care is going, like more of merging those two together?
Absolutely. I think the businesses that will incorporate that holistic approach, they will really flourish. I really believe that your patients are seeking that. And once you offer that kind of approach and spend the time and become knowledgeable about those tools, and start educating your patient, they will love you for it. They'll bring their whole community to you. And it's going to help also rejuvenate your staff, your team, because they will feel more fulfilled. Because if an injector, for example, injecting all day long, but she would, I think, get more out of it, more oxygen from that interaction when he or she is talking about their overall quality of life, and patients would love to share. All they have to do is ask. And at the end of the day, we're clinicians, we're scientists, we are healers. So I truly believe that we're not robots, right? So because that's why ChatGPT is not going to take over medicine, I'm telling you. So when people like us are around, we will always be needed. But once you allocate the time and give them the time and ask them the right approach. And then once your antenna is up about how to have that 4,000 feet view of that patient and look at all these approaches. So I have 5 pillars that I show kind of a Venn diagram on my computer that I look at: anti-inflammatory nutrition, removing toxins, optimizing their stress, balancing hormones, and at the same time, a healthy lifestyle. All these things I try to optimize, and that's like basic my wellness paradigm that I go over with my patients. And then each visit, I revisit those paradigms.
Well, I mean, there you go. That's the secret to a good life and good health. Now, Dr. Siddique, I have one last question for you, but before I ask it, I want to point people to your website at www.sleep-wellness.org. So the last question I have for you is, what do you think is the most important piece of advice you can give to someone who's maybe on the fence as far as they may have tried a couple things before, they're living with some type of pain or discomfort or some issue, and they're not quite sure, should they really try and see somebody to get this fixed because everything they tried before has not worked? What would be your most important piece of advice you can give to someone like that?
Well, don't lose hope. Most important advice I can give you is that keep searching for the providers who are more holistically minded and functional integrative type of practice. And there are practices like that. There are naturopathic doctors. My background is osteopathic medicine, so that's kind of was ingrained in my educational DNA. But there are providers out there who practice this holistic aesthetics, holistic medicine, and then be kind of persistent in your research, and then be your best advocate. You are your best advocate. Don't just be passive, and then keep searching, and then do your own research, and then ask your primary care, hey, how about this? How about that? Can you check my gut health, or I did my hormone levels checked? How about, I have this chronic pain, instead of just keep pushing medications, what can I do organically and holistically to get better? What lifestyle measures that I should be doing? And then there's a lot of help out there online, and you become your best advocate through your knowledge, your education. And then when you have a willing advocate as a caregiver, your healthcare partner, I call myself a partner in their wellness. So, and we work together. And then you have, so if you are not satisfied with your current care provider, keep searching, because if you are not asking for the best quality, you are not going to get it. So you have to keep seeking for that fine balance where the person takes interest in your well-being. And this is not going to happen automatically. If you are just passive about it, it's not going to just fall on your lap. You have to seek it.
Okay, well, that's fantastic. I mean, there you have it. Dr. Siddique sharing his expertise and giving these wonderful recommendations. Now, Dr. Siddique, where can people contact you and your practice?
So I'm located in Lawrenceville, New Jersey, which is right next to Princeton. We're 45 minutes from Philly, 50 minutes from Manhattan. My phone number is 609-587-9944. Our website, as Daniel mentioned, it's www.sleep-wellness.org. My Instagram handle is Dr. All Things Skin. You can also find me on the same handle on TikTok. And we would love to hear from you. If you are having these difficulties, I'd love to hear your stories, and we can take a deep dive into how to help you live your best life.
Well, great. Well, thank you for being on the show, Dr. Siddique, and sharing your message with the world.
Thank you again for having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.